This is Brooke Ginty, and welcome to another edition of VOXIPOP's Community Town Hall. As COVID-19 shut down our schools and kept us indoors for more than 3 months, many parents and their children began to feel the weight of homeschooling, missing friends, and generally just missing the world beyond our front doors. In the beginning of June, Chester County announced it would move into the yellow phase, which included reopening daycare facilities and summer camps that would comply with CDC and Department of Health guidelines. But for parents, many of whom thought camps and daycares would be out of the question for this summer, the question still remains: is it safe for my kids and our family to return to school? Joining me today to help answer this question is Dr. Stephanie KALINER, family physician at Phoenix Family Medicine, and Janelle Work, the owner of Kiddie Academies of Phoenixville and Royersford. Say the nice welcome to our guests. Hi guys, thank you for joining me.
Thank you so much for having me on today.
Thank you, Brooke. It's great to be here.
Hi, guys. Hi. Okay, let's get started. So I remember the exact moment when I was frantically trying to determine how to get my children out of my hair while I was working and learning that daycares were opening in the middle of June. So along this process, I feel most of our conversations, there haven't been many guidelines about what to do and how to move through this pandemic. Dr. KALINER, let me start with you. When it comes to daycares, summer camps, do we have guidelines that can help us along the way to answering these questions?
Yes, the CDC and the Department of Health came out with a bunch of guidelines for camps and daycares to open. They've rolled it out. We know that a lot of different camps and daycares have implemented these guidelines. And they have to meet all these certain criteria in order for them to be able to open up.
Okay, so we finally have guidelines. That's good. That is good to hear because so much of our conversations have not had guidelines. So when it comes to opening the doors, Janelle, I presume that you have been studying these like a maniac. Is that right?
When I stress, I do research. So as soon as we shut our doors in March, I just started jumping on calls and really listening to the CDC, listening to Chester County, Montgomery County, and what the recommendations are going to be. And they were definitely evolving. We were able to get a waiver to open for essential personnel, but I did not feel as an owner that we were ready to be able to handle that intake during April and May. And we spent that time period really trying to adjust to what those norms were going to be. So instead of jumping in prepared, we've been doing research and trying to figure out how we're going to best serve our communities.
All right, so let's talk about it. You have two facilities, two Kiddie Academy facilities in Phoenixville and in Royersford. So tell me what the guidelines tell you and what it looks like arriving at your center and what you have done at the daycare as a daycare provider to help keep the kids safe as we enter back into daycare.
So the first thing we did was we tried to control everything that we could control. We can't always control what is coming in outside. So we took the time that we were closed and did the things that we could never do. When you're operating in a school building for 12 months out of the year with constant little hands, sometimes you get a 3-day weekend, but here we were able to really close and utilize resources to clean, scrub our building, everything that we could. So our families are going to be walking into brand new painted walls, brand new color schemes, waxed all the floors at both locations. And then I brought back any teachers that were not able to get it from one reason or another. And they helped me scrub every single little toy, every rug, everything in the center from top to bottom. We had huge tubs outside where we were just going through all the different items, making sure when we were putting this back in the room that we were coming back in a little more sterilized environment, because it's a lot easier to control the germs ready to go. We also did admin meetings via Skype with my 6 administrators 6 weeks prior to opening. We established what you're seeing right now is one of our entrances that's on wheels. It goes in and outside of the center. It has a COVID checklist and tons of PPE supplies, thermometers, things like that to help us monitor the case. Your day is going to look very different coming back. I really believe that some of the things are very positive from a childcare standpoint, and we're able to control factors moving forward in this new. For instance,
So let me, one sec, let me cut you off here. And, you know, Dr. KALINER, I want to come to you as a physician. I know as a parent, this decision has been very important to me that I speak with my own pediatrician. So what sort of things are you telling parents to look out for, to ask their daycare providers? What sort of guidance are you giving to individuals like Janelle, who is, you know, as a business owner, trying to open up her doors and make sure that she stays safe?
Well, coming back into green and even in the yellow phase doesn't mean that the virus is completely gone. You know, it's an invisible virus. We can't see it. We have to make sure that you're protecting yourself. And if you're following the guidelines from the CDC, you should be protecting yourself. And that's going through various things where you're washing your hands as much as possible, especially if you're after you eat, before you eat. If you are going through and you're going to be within 6 feet of somebody else, that you're wearing masks. Now, masks are recommended for everyone, except for under the age of 2, where children can suffocate under the age of 2. But when you're under the age of 2, masks everybody should be wearing if they're going to be near other people, not their family members. If you're also doing constant monitoring of patients, like before, I say patients, but I've children, like knowing their temperature before they go to a camp is helpful. I'm sure that different regulations from the CDC that come into play, I think they're having a lot of them monitor the kids. Having a plan that if you do have a child, when they do go to the camp or the daycare, knowing what is their plans, and understanding as a parent what their process is for bringing your child there, checking them in, and having them be safe there, and then leave to come home and making sure they're not bringing anything with them. So another factor is when they come home, you know, they should also wash their hands and kind of disinfect themselves as they come in the door. And if you are practicing these proper safe things with frequent hand washing, 6 feet away, in your face mask. If you're not with a face mask on, make sure you cover your mouth. That will definitely help reduce the spread of the virus.
Okay, that makes me feel a lot better. Although I do know in speaking with Janelle that Janelle has not just implemented the CDC strategies, but I know that she's gone above and beyond. So Janelle, tell me, I'm a parent arriving at your daycare center. Take me from door to classroom and describe the things that as an owner you have done at Kitty Academy to take into account the CDC guidelines and the suggestions of Dr. KALINER that she just mentioned.
So when you pull up for the first time, it's going to be a very different world at Kitty Academy. You're still going to have the same amazing teachers, but you're going to pull up and you're going to see orange cones outlining our building. Each of those cones are spaced apart so you can pull up into a parking spot and get out safely with your child on a parking spot right next to it, not near any other individual. At that time, one of our administrative staff will be coming out to you. They will be doing a health screening of your child with a non-touch thermometer. And then we will also be screening you with 5 or 6 questions on essentially COVID-19. And we will record those answers every single day, due diligently. We'll also be asking you what approximate time you'll be picking up that evening so we can make sure that we're spacing out our families and accordingly. Then your child will walk into the center with our staff members, and they will walk directly back to their classroom. As you can imagine, raising 2 kids of your own, you cannot socially distance children. You can try, you can talk to them about it, but they are love bugs, full of energy and spunk. So we're not socially distancing them from their class members. What we are doing is limiting their contact with others. So your child will right back to his preschool room. He would greet his teacher, and he will stay with that group of kids that whole entire day. They will move out to the playground together. We will sanitize the playground after they leave so other classes can enjoy them, but they're not going to be combining forces like they were before. They're going to literally limit their contact of teachers and outside classes. Summer camp's different. We always bring in magic shows and all of these events in-house. And we used to put about 70 kids in one room together. We are not doing that this summer. We are limiting those type of activities that we can do safely with the kids. So soccer is still happening, but it's being by class, not the whole school. Different type of activities like that will limit their contact, limit their potential outreach, but also screen our families as they're coming in.
Okay. You've put a lot of thought into this. While I have Dr. KALINER on the topic of masks, I think it's one of those, for whatever reason, hot button questions. You know, in Phoenixville in particular, I know they've opened up the downtown and the main street, and you see a lot of people not wearing masks. So can you kind of just discuss your impressions of statistics on masks, and should we be wearing them in public? You know, how far away we are from people in public, if we're running on the trail, anything like that. If you can just kind of go over some guidelines for parents as we start to move out of our homes and into the community this summer with our children.
So it's interesting, they actually came out with some studies recently, and I looked at different studies, and they had from other countries, from some of the Asian countries, the way to stop the spread of the virus, the biggest factor was actually masks. When more people are wearing masks, you're protecting and you're stopping that droplet exposure, which is the main reason of how COVID spreads. So masks are very important, but then the question comes into play, okay, when do we wear them? How do we wear them? What type of mask should I wear? There's several different types of masks you can get. Now, if you're out in the general public, you don't need to have those N95 masks. You're not doing procedures. You're not doing things that are making you at high risk. Those are masks that are specific for physicians. The surgical masks are really specific for healthcare workers or people working in like nursing homes and in very closed quarters. Those are that type. So any kind of face covering, as a constant face covering, it's going to catch your droplets. It's going to reduce spread. So the general population just needs some type of face covering. Whether it's a homemade mask, that's fine. Even if you don't have that, a bandana can do its job. It is recommended that if you're going to be like inside, in closed doors all the time, yes, if you're going to be within 6 feet and you're an adult, you really should have a mask on. Children, there's other ways to do it. And you should be wearing your mask appropriately. A mask is not going to be very effective if it's not around your nose and it's totally covering your mouth. So make sure that, the way you have a mask on, that you can breathe through it. Make sure you wear it when you're in public, in a closed public setting. So if you're outside in the park and or you're at a pool and you're stationary and you're more than 6 feet away from everyone and you're just sitting there, yeah, okay, you can take your mask off, and if you're eating, you can eat. But if you're getting up and you're going to be walking by the lifeguard, or you're going to, know that you're going to be in close proximity to someone, then yeah, you should probably have a mask on when you're within 6 feet. And then make sure that you're washing your hands, because if you go and you have a mask on and then you take your mask off, you eat and you're touching a bunch of surfaces, and then you're putting your mask right back on, you actually could be contaminating your mask with whatever you've been touching with your hands. So you make sure that you're washing your hands, before and after you take your masks off. And you should wash your masks every day if you have a cloth mask. Because also if you're using the same mask, you can also have that not as good for your health. So masks, I think, are one of the key important things to help protect you. But there are times where it's okay if you don't have the mask off. Now, if kids are secluded together and they're with the same kids and they're, disinfected and washing their hands if they come in, and then they get their group and it's just a small number, that's okay if, under the age of 12 was a CDC guideline for camps and daycares, that they're okay to go interact without masks on.
Okay, you answered one of my questions, which was, what do we do about washing the masks? Because I will yell at my husband when he walks in the door today wearing the same, I don't know, I guess they're called gaiters or whatever ones that just come up over his mouth. So I'll make sure. So we're washing them every day, which means generally we're probably going to need more than one mask, because we're going lots of places with masks these days. any idea what going green means? Let me start, back with Dr. Kaliner on the masks. What do you think going green means for mask wearing, and what would be your advice to the community?
I think that just because we're green doesn't mean that COVID is gone. Doesn't mean that we're all safe. Let's go back to how it was. For me, I think that, masks should be utilized. But again, kind of what I said before, that if you're more than 6 feet away from someone else, you're not going to catch those droplets, that it might be okay to take them off. But if you're going to be in close proximity, where you should still, be respectful of wearing masks, especially when you're in closed spaces.
All right, that's very helpful. Thank you so much for that. Now, Janelle, what are your teachers doing when it comes to wearing masks in school? And are there any other protections that the staff are taking to help make sure that the kiddos are safe?
So I had the advantage of talking to a lot of the franchisees across the U.S. during these last few months and really learning from the positive and negative experiences that they were going through. And one of the franchisees strongly suggested wearing scrubs for their teachers. We can't always control the sanitation of our employees walking in, but as soon as they walk in, they're essentially changing very similarly as a hospital. So you'll see my teachers are in a t-shirt that says Kitty Academy, which we're washing on site, and we purchased several $1,000s worth of scrub pants that we are washing every day after their shift. Also, as you know, bodily fluids happen in childcare. My poor infant teacher had a bottle explode with him yesterday. We got the phone call immediately in the office and went down, relieved him so he could completely change and get out of that and sanitize his body. So currently, we are asking employees to come in, change into their uniforms that we are actually washing on site, and then they are not leaving anything. So when we are moving green, they are excited because they'll be able to leave the building briefly to pick up a hot or warm lunch and not always bring it, but we're asking them again to still go through that sanitizing process as they're coming back in, but giving them a little more freedom. The biggest thing my clients are excited about with green is it means longer operation hours for us. So we will be starting at 7 a.m. drop off instead of 7:30 starting the month. And we're also hoping to have some safe field trips this summer, especially for those kids that are going in kindergarten, giving them that experience of what a small bus trip would be. We'll be choosing very specific sites that will just be our crew. So we're not going to a movie theater or some other type of large. We're really looking at small parks that the kids can experience in the little rivers or the fish. We're going and seeing our milk farm where we get all of our fresh farm milk, where it would just be our Kitty Academy 12 kids. So we're really trying to be very specific and strategic with it moving forward, but it's going to give us a little more freedom. But at the same time, we're very grateful that this pushed our school almost forward 10 years in operation. Brooke, as you know, my clients would have never said it was okay for an outside drop-in. I was that mom who sat in with my daughter at breakfast, making sure she wasn't having anxiety as I was leaving in the classroom. Yep. But limiting 300 plus people walking through my building, just that statistic alone, is going to really help us take care of less contagion across the board.
I think that kind of goes one of the upsides of COVID, if there are upsides. But I mean, I think a lot of businesses and a lot of institutions have begun to learn how to do things differently. And I will miss the days of walking in and talking to my teacher and getting the reports and knowing them face to face. But I'll tell you what, you go to the early learning center, you don't go into that school, you drop that kid off and you're like, wait, what? I can't talk to you? So it's a totally new world. So, all right, let me ask a question about summer activities to Dr. Kaliner. So we've got daycares and summer camps, and it sounds like follow the CDC guidelines, but ask the questions to the providers, right? And they should be able to give you the answers that follow those guidelines. Let's talk about summer activities. Swimming, taking hikes, going to the beach. What's your kind of thoughts on getting us out of the house this season?
Well, the pools are good in the water, you're not going to spread the virus. So while they're in the water, that's fine. I think it's safe. A lot of the pools that have opened up have guidelines that I think if you follow the guidelines, I think it should be good. But I think a lot of the pools are working with reservations. You can't just show up and go to a pool. With beach, again, a lot of the beaches that are open have regulations. I think the beach itself, I think you have to be at least 10 feet away from the next person parked there. So that regulation will also help distance people, which will also help. And outside summer activities, I mean, there's certain games that the kids aren't going to do, or the games will be adjusted. My two children go to a camp that has opened, and it's all outdoors. And some of their games, for instance, they play Gaga. Instead of it having the whole bunk in playing, they're only doing 3 kids, so they can, have their space in the court, yet not bump into each other. Certain games are more feasible, and there's other games where if they're going to have extreme close contact, they're not going to be able to do. So we're seeing a bit of a shift, but they can still play and socialize, and it's important for their mental health and their physical health to get those interactions with their friends and socializing.
That's good to hear. I know we've kind of created our quarantine crew. It's a new term we're all apparently using these days, but we live in row homes and you can't escape the fact that your neighbors are literally right next door. So we've got some kids out there, but I know my kiddos need to get back out amongst a bunch of other kids safely because they're driving themselves crazy and me crazy. Side note. So I always do this with my guests. I give them what I call my one last thing. So if there's something that you haven't discussed about but you feel is very important to discuss about, let's start there. I'm going to start with Janelle. What is your one last thing for parents who are trying to make this decision about returning their kids back to normal?
I think the best thing you can do is continue to talk with your child about their school is just going to be a little different, and making sure that you're not placing those fears that you have on them because they're processing it at a young age. Having those simple discussions on our teachers are wearing masks because they're trying to keep us safe, and showing them happy pictures potentially of their teachers in masks really kind of help prep those visuals as they're changing. Stay strong, believe that we're going to get this together, and have the right conversations with your child care directors, with your owners as you're moving forward. And if they're not having those conversations, really kind of think about what you need as a parent. But the answers are there. I feel like we just have to move forward as a society into this new semblance of normalcy. We're taking the right steps and we're moving forward together in a partnership. I really believe that we can get through this.
Thank you. Dr. KALINER, your one last thing.
So just because we're going green doesn't mean that the virus is gone. You do have to, it's good to interact and play and kind of go back to normal, but at the same time, it's a new normal. And you have to do what's right for you and for your family. It's great to have the kids going out and playing, but do remember that the virus is still around. It's not gone.
Okay. As I say to my kids, pairing means we just stay a daddy's distance away from people. That's how I try to describe it to them. All right. Thank you so much. As a parent, this conversation is extremely helpful in making the decisions for my family. And I know on behalf of my community, they're going to feel the same way once they have a chance to see this. So thank you so much for your wisdom. I appreciate you joining me today. And I hope you guys enjoy your summers, okay?
Thank you.
Thank you so much.
All right, this is Brooke Ginty with VOXIPOP's Community Town Hall. As always, please remember that this is a video on demand, so if there's information that you found here helpful and you want to share it, please do so. You can find our videos on voxipop.com/townhall. Follow us on Facebook to keep up to date with the most recent VOXIPOPs that'll be coming out and any other news. And as always, thank you so much for being a member of my community, our community. We're in this together. I want you to stay safe, be well, and safely enjoy the summer as we try to start returning to normal. Have a great day.